Do you often find yourself feeling dizzy or getting headaches without knowing why? Or maybe you think these are just normal everyday problems. But what if they could actually be warning signs and symptoms of high blood pressure? The truth is, high blood pressure doesn't always show up with obvious symptoms, and you might be ignoring some very serious high blood pressure warning signs and symptoms right now without even realizing it. Here's the challenge. What if everything you've thought about high blood pressure symptoms is wrong? What if the signs of high blood pressure are right in front of you, and you've dismissed them as something minor? It's time to take a second look at these common high blood pressure symptoms. Stick around till the end because I'll share one symptom that most people miss, one that could be putting your health at serious risk. High blood pressure, or hypertension, is often called the silent killer because it can sneak up on you without showing any obvious signs. That's why high blood pressure symptoms you should never ignore are something we need to be aware of. Many people have signs and symptoms of high blood pressure and simply brush them off as something else. But by doing so, you're playing with your health and possibly your life. Today, we'll go over 10 blood pressure symptoms that you should watch out for. These high blood pressure symptoms may seem harmless at first, but ignoring them can lead to serious consequences like heart disease, stroke, and kidney problems. So, let's get into the warning signs and symptoms of high blood pressure, and I promise you'll learn something that could change your approach to staying healthy. 1. Dizziness and lightheadedness. Many people just associate dizziness with being tired or overworked. But did you know that dizziness is actually one of the first high blood pressure symptoms dizziness can signal? This could mean that your brain isn't getting the oxygen it needs due to increased pressure in your arteries. High blood pressure forces your heart to pump harder to circulate blood, which can lead to changes in the flow of blood to your brain, causing dizziness or lightheadedness. If you're feeling dizzy without an obvious cause, this could be an early warning sign that should not be ignored. The reason why many people dismiss dizziness as just being tired is because it often happens in everyday situations when you're doing something like standing up quickly or sitting down after standing for a while. However, frequent or prolonged dizziness could point to more severe underlying health issues like hypertension. So, don't take that lightheaded feeling lightly. If it happens regularly or suddenly, be sure to monitor your blood pressure. But is it always high blood pressure that causes dizziness? Keep watching to find out. 2. Blurred vision or vision changes. You've probably experienced blurry vision from time to time, but did you know that high blood pressure eye symptoms like blurred vision or seeing spots might indicate a serious issue with your blood vessels? High blood pressure can cause damage to the blood vessels in your eyes, leading to blurred vision or even loss of vision in some extreme cases. This happens because the small blood vessels in your eyes are very sensitive to changes in blood flow. When your blood pressure is high, it can cause the vessels to burst or leak, resulting in a variety of vision disturbances. This is why your optometrist or ophthalmologist can often spot high blood pressure signs before you even notice them. In fact, blurred vision can sometimes be one of the most noticeable signs and symptoms of high blood pressure. So, if you suddenly find yourself squinting to see clearly, or if you're seeing flashes of light or spots, this could be a clue that you have high blood pressure and should get your eyes and your blood pressure checked right away. What's the one type of vision change you should never ignore? Let's uncover that next. 3. Chest pain. Do you think chest pain is just a sign of stress or anxiety? While it can also be a warning sign of a more serious issue like high blood pressure affecting your heart. High blood pressure causes the arteries to narrow and become stiff, which forces your heart to work harder to pump blood. Over time, this can lead to heart damage, including conditions like angina or even heart attacks. Chest pain caused by high blood pressure often feels different from the usual kind of pain that comes from stress. This type of pain might feel tight, constricting, or pressure-filled, and it may also radiate to your arm, back, or jaw. If you ever experience chest pain or discomfort, especially if it occurs with other symptoms like shortness of breath or dizziness, seek medical attention immediately. Many people chalk up chest pain to indigestion or stress, but in some cases, it can be a warning sign that your heart is under distress from high blood pressure. What's the most dangerous thing you could do when experiencing chest pain? I'll explain shortly. 4. Frequent headaches. Headaches are common, but did you know that high blood pressure symptoms could be the cause of persistent or severe headaches? These headaches are often described as pulsating or throbbing, and they occur due to the strain placed on the blood vessels in your head from high blood pressure. The increased pressure in the arteries of your brain can lead to tension and pain, especially when the pressure is very high. Frequent, unexplained headaches, especially those that seem to occur at the same time each day or get worse with physical activity, could be a sign that your blood pressure is dangerously high. Many people simply reach for over-the-counter painkillers to ease the discomfort. But these types of headaches require more than just a quick fix. If your headaches are persistent and accompanied by other symptoms like dizziness or blurred vision, this is an alert to get your blood pressure checked immediately. But do you know what type of headache is a red flag for high blood pressure? Let's uncover that next. 5. Shortness of breath. Shortness of breath might seem like a problem that's tied to your lungs, but it's often connected to high blood pressure symptoms. Over time, uncontrolled hypertension can cause your heart to become weakened and less efficient at pumping blood. As a result, blood and fluid start to back up into your lungs, making it harder to breathe. This condition is called congestive heart failure, and it's a serious consequence of high blood pressure. In some cases, shortness of breath can happen after light physical activity or even while you're at rest. If you feel winded or unable to catch your breath, it's important to take note and seek medical attention, especially if this symptom becomes more frequent. But is it always related to high blood pressure? Find out what else could be the culprit. 6. Nosebleeds. It might sound surprising, but nosebleeds are actually one of the common symptoms of high blood pressure. When your blood pressure is high, it puts extra strain on your blood vessels, including the tiny vessels inside your nose. The force can cause them to burst, leading to a nosebleed. While an occasional nosebleed might not be a cause for concern, frequent or unexplained nosebleeds could indicate that your blood pressure is dangerously high. Many people think they are just unlucky, but recurring nosebleeds could be a red flag for hypertension. If you find yourself reaching for tissues more often than usual, especially with no clear trigger like allergies or dry air, consider getting your blood pressure checked to rule out any serious issues. But what should you do if you get frequent nosebleeds? Stick around, we'll share the best action plan shortly. 7. Fatigue. It's easy to blame fatigue on a lack of sleep or too much work, but unexplained tiredness can also be one of the signs and symptoms of hypertension and high blood pressure. High blood pressure forces your heart to work harder than it should, which can wear you out over time. When your heart is constantly under pressure, your energy levels can dip, leading to persistent feelings of exhaustion or fatigue. Even if you're getting enough sleep, fatigue from high blood pressure often comes on gradually, so you may not even notice how much it's affecting you until you're drained at the end of the day. But what should you do if fatigue becomes a constant issue? The answer might surprise you. 8. Ringing in the ears. It's not just an annoyance. Ringing in the ears, or tinnitus, can actually be a sign that your blood pressure is too high. The excess pressure can affect your inner ear, causing constant buzzing or ringing sounds. This happens because the blood vessels around your ear are being affected by high pressure, causing the ringing sensation that never seems to go away. People often ignore this symptom because they think it's just a minor inconvenience. But tinnitus can be a direct result of high blood pressure. But how can you tell if this is connected to blood pressure and not something else? Keep watching to learn more. If you've made it this far, you're clearly serious about protecting your health, so why not take a second to support this video? A simple like helps more people discover these life-saving symptoms of high blood pressure. Go ahead and hit that like button now. It only takes a second, but it makes a huge difference. And stick around because the next symptom might surprise you. 9. Sweating without effort. Excessive sweating, especially when you're not doing anything strenuous, can be a hidden symptom of high blood pressure. The reason behind this is that your body is working overtime to regulate blood flow, and this can trigger sweat production. Your body is trying to cool itself down as it deals with the added strain caused by hypertension. If you find yourself sweating excessively even when you're sitting still or at rest, this could be a sign that something's off with your blood pressure. But is there a more serious underlying cause for this? We'll reveal that in just a bit. High blood pressure can be silent but deadly, and many people ignore these warning signs until it's too late. But you can help change that. If you found this information valuable, Share this video with your friends and family. You never know who might be experiencing these symptoms right now without realizing the danger. A simple share could help save a life. And now, let's move on to the final symptom. You won't want to miss this one. 10. Nausea and vomiting. It's easy to think nausea and vomiting are just stomach-related problems, but these can actually be signs of high blood pressure symptoms affecting your brain. High blood pressure can lead to a sudden increase in pressure inside the skull, leading to nausea or vomiting as your body tries to cope. This symptom can be especially concerning if it happens suddenly and without a clear explanation. So, how do you know when to get help? Stick around for the answer. Now that we've covered the 10 blood pressure symptoms you must not ignore, it's time to answer the biggest questions we raised throughout the video. Each symptom came with a warning, but what's the real danger behind them? You might have wondered, is dizziness always caused by high blood pressure? What type of vision change should you never ignore? And what's the most dangerous mistake you could make when experiencing chest pain? In this section, we're breaking down all the answers so you know exactly when to take action. Let's get into it. 1. Is it always high blood pressure that causes dizziness? No, dizziness can also be caused by low blood pressure, dehydration, inner ear issues, or even neurological conditions. If dizziness is persistent or severe, it's essential to seek medical advice. 2. What's the one type of vision change you should never ignore? Blurred vision, especially sudden or worsening, is a major red flag for high blood pressure. It can indicate hypertensive retinopathy, which can lead to permanent eye damage if left untreated. 3. What's the most dangerous thing you could do when experiencing chest pain? Ignoring it or assuming it's just indigestion could be life-threatening. Chest pain related to high blood pressure can signal a heart attack or a hypertensive crisis, requiring immediate medical attention. Your health is your greatest asset, and staying informed can help you prevent serious health issues before they start. If you found this video helpful, make sure to subscribe to HealthFlex for more expert-backed health tips, nutrition advice, and natural remedies. 4. Do you know what type of headache is a red flag for high blood pressure? A pounding headache, often at the back of the head and worse in the morning, could indicate dangerously high blood pressure, known as a hypertensive crisis. Seek urgent medical care if it happens frequently. 5. Is it shortness of breath always related to high blood pressure? No, shortness of breath can also be caused by lung conditions like asthma, anxiety, or even anemia. However, if it's combined with high blood pressure, it might indicate heart failure or pulmonary hypertension. 6. What should you do if you get frequent nosebleeds? First, stay calm. Tilt your head forward slightly and pinch your nostrils. If nosebleeds happen often and without injury, check your blood pressure. Uncontrolled hypertension can be a cause. 7. What should you do if fatigue becomes a constant issue? Chronic fatigue could be linked to high blood pressure, but other causes include sleep apnea, anemia, or thyroid disorders. If it persists, get a medical checkup to determine the root cause. 8. How can you tell if ringing in the ears is connected to blood pressure and not something else? If the ringing in your ears pulses in rhythm with your heartbeat, pulsatile tinnitus, it may be linked to high blood pressure. Other causes include ear infections, stress, or exposure to loud noise, but if it's persistent, a blood pressure check is a must. 9. Sweating without effort. Is there a more serious underlying cause for this? Yes. Unexplained sweating could indicate a hypertensive emergency, a heart attack, or even endocrine disorders. If it's paired with chest pain or dizziness, seek emergency care immediately. 10. Nausea and vomiting. How do you know when to get help? If nausea is accompanied by severe headaches, vision problems, or chest pain, it could indicate a hypertensive crisis. Seek immediate medical attention, as it may signal dangerously high blood pressure. These warning signs shouldn't be ignored. If you experience any of these symptoms frequently, it's time to take action and consult a doctor. What's your experience with high blood pressure symptoms? Have you noticed any of these warning signs in your life? Drop a comment below and let's talk about it. Now that you know the 10 blood pressure symptoms you must not ignore, the next step is taking action to keep your blood pressure under control before it leads to serious complications. And guess what? You don't need medication alone. Nature has powerful solutions. Did you know that certain teas can naturally lower your blood pressure fast? But not all teas are created equal. Some have scientifically proven effects on relaxing blood vessels and reducing hypertension. In my next video, how to lower blood pressure fast with these 8 teas. They'll reveal the best teas that work like natural medicine to stabilize your blood pressure. Watch now and start sipping your way to better heart health.